It's all coming up on the season premiere of Almanac North. Hello and welcome to Almanac North. Thanks for watching. This week's show was recorded on Wednesday, so the WDSE crew could prepare for this weekend's symphony broadcast. And we'll have a little more on that later in the show, but Denny, right now, welcome back. You've been gone for a couple of weeks.
A couple of weeks. I was on a WDSE holiday vacations tour through the Canadian Rockies. Lots of fun. Pretty area.
Sounds like you had a nice time.
We
and
did.
Pat Kelly was here holding down the fort for you.
That's what I understand.
It was good. And it's the start of our 24th season, so let's get to our first guest.
All right. Thank you, Julie. Quite a milestone. Thank you very much. Well, every 5 years, thousands of Northland residents are asked to fill out an important health survey. The Bridge to Health survey is being mailed out this month to randomly selected households in northeastern Minnesota and northwestern Wisconsin. More than 60 organizations in the region help support the survey, and organizers say if you receive one, it's important you fill it out completely. Joining us with more is Jenny Peterson of Generations Healthcare Initiatives, which coordinates the survey, and Annie Harala is the Healthy Northland Regional Health Improvement Program Coordinator. Thank you so much for being here. Jenny, why is this survey so important to the Northland?
Well, Denny, this survey is really important. It's been done every 5 years since 1995. And over 60 health organizations, as you said, use this data to do programs and services that really help to meet the needs of the local residents. So we'd like to hear from local people to tell us what's important to them. We have hospitals, we have clinics, we have public health, we have organizations like the Cancer Society and the Lung Association.
They will all benefit from it?
They will all benefit, and that's why it's so important, because otherwise we may not plan what's really important to the people in this region.
What health topics are covered in the survey?
You know, there's many topics that are covered in our survey, from average weight, height, it's how many vegetables you eat a day. Jenny, feel free to join in as well too. You know, so many different topics that are covered to look at all of the health of the region.
Yeah, we look at chronic diseases. How many people in our region have diabetes? Are people getting mammogram screenings? Are they insured? If they're delaying care, why are they delaying physical, mental, or dental care?
Sure. So how is this survey distributed then to the public?
This survey is being sent to over 20,000 households in the region, and it's coming by mail. It'll come in a very nice envelope that says Bridge to Health Survey, and so when you see that logo, you know that it's important to this region.
And this is different than you've done in the last few surveys, because if I recall correctly, it was a phone survey in the past.
That's correct, Julie. It was done by phone the last 3 times, and but as we know, cell phones are just so much more prevalent these days. And so we had to change from a phone survey to a mail survey, because it's very problematic doing a survey with cell phones right now, and it's also pretty expensive. So we felt we could do a better job just by doing it by mail.
So Annie, how will the results of the survey be used? We've mentioned now that it'll go out to a lot of different organizations, but how will they use that information?
Well, public health and a lot of health organizations, along with nonprofits, use the data to implement evidence-based practices across the region. I coordinate a grant in Northeast Minnesota called the Statewide Health Improvement Program, and we work on finding community-based ways for people to be active, to eat healthy, to quit smoking, and so we're able to find, to use this data to kind of head in the directions that we need to do that. So looking at we know that food insecurity is a huge issue, and we learned that from seeing trends in the data change over 10 years of the survey where the question was answered. And so we paired that with data, and organizations looked at putting food in, working on food access issues in the Lincoln Park neighborhood, and we'll see more work like that happening across the region.
Are there specific areas of concern that perhaps were identified in last survey or the survey before that, that organizations in our area have really worked hard to try to make some progress on, that you're really looking at this time to see if any of those changes have been effective?
Well, I know one for our organization works a lot looking at healthcare access in the uninsured, and we're really interested in seeing the impact of the Affordable Care Act in MNsure. We have always had a higher than average uninsured rate in this region compared to the rest of the state, so we're really looking at that.
Yeah.
We've also added some new questions in the survey. For example, e-cigarettes, they weren't an
They weren't
issue.
here before.
No, they weren't an issue 5 years ago, and so we're really looking at some of those trends too.
Jenny, in the past, have you found any surprises in these surveys that maybe you didn't suspect?
Well, I think what we've really looked at some of those trends. Actually, last time our obesity rates did not go up all that much. I mean, they had been trending upward for several years, but in 2010 they were pretty similar to 2005. But I think one of the most dramatic things we've witnessed over since 1995 is really the decrease in smoking. In 1995, the smoking rate was 24%. This in 2010, it was down to 14%.
Really?
So, I mean, it's just been fun to watch those trends and see how the impact of some of our local initiatives, you know, the no smoking campaigns in restaurants and bars and things like that have really made an impact.
Is this survey unique to our region, or is it conducted on a local level across the state and maybe even in other parts of the country?
So this is our survey is unique. It's built with collaboration of many partners, but pieces of the survey are given across the state. In fact, the statewide health improvement program with the Minnesota Department of Health is mandating a similar 11 questions statewide. So all 87 counties will have the same data when it comes to fruit and vegetable intake, tobacco use, and really in physical activity. So we'll be able to look statewide. But it's unique to our region, and we can be really proud of the data that we have because of the involvement that we have of people across the area.
Do you wish respondents to give their names to, or no?
No, it's completely anonymous. We really don't care who you are. What we're looking at is the aggregate number. Like, what do the people in Duluth feel? What do the people in International Falls or Aiken feel about what's happening in their county and what's happening with them?
And you mentioned that it goes out in the mail, and people receive an awful lot of mail that's unsolicited in their boxes. How do you get them to respond? What would be a good response rate? And how do you ensure that people actually send these back in?
Well, this is why we appreciate being on your program. We want people to know how important it is to their local hospital, to their public health, to all these organizations, because I know we get a lot of mail, and I always say if it's sitting in that pile and you're watching this program, go get it out and fill it out.
Yeah.
It only takes about 15 minutes to do, and it's vital information for your local hospitals and clinics and all of us.
Annie, your organization looks at a lot of different counties. As you review past results of the survey, are there different healthcare challenges or health challenges in those different geographic areas? Are people experiencing different things in Lake County than they are in St. Louis County, or in rural areas versus the more urban areas?
You know, what we've come to find is that there are varying areas, that some of the numbers vary from area to area, but what we do see is a common trend that our region does have high rates of chronic diseases and heart disease, hypertension, stroke, and those are all that are related a lot to obesity and tobacco use. And so we do see that kind of region-wide.
Are you finding some respondents not seeing doctors? They simply can't afford health care?
Oh yes, we've had that reported on surveys in the past, and we ask, you know, what are the reasons they're not seeing the doctor? And a lot of it is cost or no insurance, and that's why we're interested in seeing how the Affordable Care Act. But there's also transportation issues for some people. One comment too about people not wanting to see a dentist, sometimes they're just nervous about seeing a healthcare provider, especially dentists for some reason.
And your organization, as you mentioned, was pretty involved with the Affordable Care Act in our region, trying to make sure that people knew what options were available and connecting them to the right people. Do you get a sense going in what the impact might be, or how are you feeling about that? Do you feel like it's made a difference?
Oh, definitely. I feel it's made a difference. And we have seen statewide data where the rates of uninsured are almost in half. and we're hoping that that's true in our region, but we won't know until we get the survey.
And is mental health addressed at all in the survey? Either one of you?
Yes, it is. Mental health is certainly an issue that we hear more and more about.
Yeah, we do it today.
So we ask if people have access to mental health care, if they've avoided care or not received it when they thought they needed it. We ask about people, you know, if you've had depression or anxiety, and so we try to take the pulse of what's happening, because mental health is a major part of your overall
Do you think
health.
today we're trying to take the wraps off mental health, where people are more likely today than, say, a decade ago to talk about those kinds of issues, or at least answer questions?
Health organizations are working really hard to combat the stigma that comes with mental health, and we are seeing a lot of initiatives of people coming together to learn, and and a lot of counties, I know Cook County has a big initiative around mental health and really supporting mental health of the people in their county, and many counties as well partner to do that.
Sure.
I know Douglas County, when they did their community needs assessment and used the Bridge to Health data and other data, really found that mental health was an issue, and there's a good community collaboration going on right now there.
Good.
Time is always an issue for people. How long does it take for somebody to fill out one of these surveys, and what information do they need to have with them when they sit down to do it? Do they need any medical records? Or is this all information that kind of comes out of them?
You should not need to have anything with you. There's no hard questions on that, and most of them are check the box. You know, do you have this condition? Have you had a mammogram in the last year? How many fruits and vegetables have you eaten last week? It's very, very simple, and it takes about 15 minutes. You don't need anything, just take it out of the envelope and start checking away.
Who processes all this information once it comes in? Does it come in, first of all, does it come in over a period of time, or do you have some real strict deadlines on when people send it back?
You know, we're working really closely with Wilder Research that will do all of the compiling of our data, as well as the Center for Health Statistics.
So the surveys are in the mail as we speak?
They are in the mail, and they are at the households. People who have maybe forgotten will get a postcard reminder at the end of this week if they haven't done it, and they probably will get one more reminder. But we really want anyone who's received the survey to fill it out, because it really is vital to making our communities healthier places.
All right, Jenny Peterson, Annie Harala, thank you both so very much.
Thank you.
Now, let's dig into our news file archive for a look at what was making news 25 years ago this week.
This gigantic flying machine is fresh from the factory, representing the latest in commercial passenger transportation. Officials say the 747-400 is part of the airline's commitment to replace an aging fleet of aircraft.
We have 229 airplanes on order coming to us in the 1990s to help address that issue. Our average airplane is about 15 years old. We have one of the more senior fleets in the United States, and we'll see that average age come down as we take delivery of more airplanes like this one.
Along with more than 400 passengers, this new jet carries with it some impressive statistics. The 747 weighs more than 400,000 pounds empty, and at full capacity can take off at more than twice that weight. It's nearly 80 yards long and can cruise at close to 600 miles an hour for 7,500 miles. A new high-tech cockpit computer has replaced the flight engineer, and it makes the pilot's job that much easier.
If you have an emergency on the airplane, it reduces the workload considerably for the crew.
In just 2 days, this brand new $125 million aircraft will make its first commercial flight to Tokyo. And officials say the new advanced technology will make the 14-hour trip smooth and reassuringly uneventful. For Late Edition, Ryan Davenport, KDLH News.
September is Ovarian Cancer Awareness Month, drawing attention to an invasive disease that kills 15,000 women every year in the United States. Yet this deadly illness gets very little attention, and no early detection test exists. For the third year running, a foundation called Charlene's Light is drawing attention to this cancer with several events in Duluth. Local fundraisers will be highlighted by the Light Duluth Teal ceremony Friday evening. Here to tell us more is Kristine Greer, the founder of Charlene's Light. And thanks for being here, Kristine.
Oh, thank you for having me.
This is a very personal cause for you, both related to your friend Charlene and your personal experience with ovarian cancer.
Yes.
Talk about that and what motivated you to really take an advocacy position.
Well, I was diagnosed with a late-stage ovarian cancer 14 years ago. I had no symptoms, which is the issue with ovarian cancer. It's usually not diagnosed till it's too late. I just went to the doctor for an annual exam, and upon examination, she said, you know, I think I feel a mass in your abdomen. And I had an ultrasound which revealed a simple fluid-filled grapefruit-sized cyst, and was told, well, just wait a month, it'll probably go away. So I waited a month and had another ultrasound which revealed a football-sized tumor that had changed in the outside cell structure. It went from benign to malignant in a month, and so I had surgery immediately. And I was at stage 3, and I was told that, you know, my odds of survival were very poor, and was sent to Mayo Clinic. I decided right then and there that I was going to survive, and I dug my heels in and I told the doctors, watch me. And so here I am 14 years later. So I was diagnosed. A few years later, my friend Charlene was diagnosed, and she too was a stage 3, no symptoms. So about after a year or so, she started to decline, and I was really thriving, and it was obvious that she was getting worse. And I suffered from survivor guilt, actually, and was speaking to her one day. The last 6 weeks of her life, she decided to live them out at home, not in a hospice, and with her family surrounding her. And I was very privileged to be able to spend a lot of time with her every day. And one day we were talking, and I said, you know, Charlene, neither of us knew anything about ovarian cancer. If we don't know, there are lots of women that don't know about this deadly disease. We have to do something. And I went home, thought about it. The next day I went to her house. I said, I've got it. I'm going to start a nonprofit foundation in your honor. So hang around for a while. Help me, you know, help me write the mission statement. Let's talk about the website. What are your dreams and wishes for this foundation? So we named it Charlene's Light because she was a very radiant woman, and with the blessing of her family, Charlene's Light was started.
Kristine, I was interested by what Julie said, that there is no early detection, no test you can take to determine if you have it. Is there a certain age group in which women should really be cognizant of perhaps there's a possibility of this?
Well, the majority of women who are diagnosed are, you know, menopausal, postmenopausal women. However, I know many women who have been diagnosed much earlier. I myself was 41. Elizabeth Bushy was a 19-year-old Duluthian who died a few years ago, and we have the golf tournament in her memory. So, you know, I think all women, regardless of age, need to educate themselves about the symptoms. They're very subtle. It's a very under-recognized, very serious threat to women's health. It's also very underfunded.
Now, many women choose hormone replacement therapy to deal with the symptoms of menopause. And you said that this comes on sometimes in menopausal women, postmenopausal. And there has been some linkage between that therapy and ovarian cancer. What do you know about that, and what would you recommend to women?
Well, I personally would recommend, you know, hold off on that and speak to your gynecologist. My GYN oncologist at Mayo Clinic said absolutely not. She was very against any type of hormone replacement therapy for women because we're starting to see some things that are concerning. So, and I'd like to touch on the symptoms, which are so subtle. You know, bloating, back pain, frequency of urination, fatigue.
But those could mean any kind of just aging.
Exactly. A woman could go to the doctor and say, you know, I'm bloated, and that could mean nothing. Then again, I tell women, if you have any of those symptoms and they last for more than 2 weeks, that's not normal. Go to your doctor and say, I really want ovarian cancer ruled out, which can be difficult since there is no early detection test. So I say, ask for these 3 things, or actually demand these 3 things.
Yes.
A
I mean,
good
you're the shopper. You can do
yes,
that.
exactly. That's
Absolutely.
right.
You bet. You're the
a good
consumer.
pelvic exam, a CA-125 blood test that can often be very inaccurate, but it's all we've got, and then an ultrasound. With those 3 things, that's the best we have right now. So we at Charlene's Light raise money for research as well as patient support. And our research focuses on early detection tests. We need one badly.
Are there multiple forms of ovarian cancer, some more rare than others?
Yes, there are. For example, Elizabeth Bushy, the 19-year-old Duluthian who died, had a very rare form. Mine too was a rare form, and they didn't quite know what to do with me. So there are different types. My friend Charlene had a multiple cell ovarian cancer, so they would be treating it with one type of chemo, but the other types of ovarian cancer cells in her abdomen were going wild then. So it's a very, very under-recognized, it's a very serious and a difficult disease to treat, and also has the highest recurrence rate of any cancer.
Really?
Now, not so long ago, there was a lot of news coverage when Angelina Jolie had her ovaries and fallopian tubes removed because she had a marker, a genetic marker, that made it likely that she could contract ovarian cancer. Is that an extreme decision, or is that something that women who might have a likelihood of getting it should be considering?
I personally don't think it's extreme. I think every woman has to make the best decision she can for herself, along with her doctor's advice perhaps. I don't think it's extreme. She had a 50% chance of ovarian cancer. Yes, she could be monitored. However, there is no early detection test. And I'm so glad that she brought ovarian cancer to the forefront. It often doesn't get enough attention. And, like you said, approximately 15,000 women a year die of this ovarian cancer.
Which brings the question, where can women go to get more information about ovarian cancer?
They can go to our website. We have symptoms and things like that on our website. There are a lot of organizations, national organizations, that have ovarian cancer information on their sites. Talk to their gynecologist. And I'm so happy that Duluth finally has a GYN oncologist, the first and only, Dr. Kristine Evans, who happens to be on our board. If a woman is ever diagnosed with ovarian cancer, she needs to go to a GYN oncologist for the debulking surgery as well as treatment, because it's such a special type of cancer.
Is there a support group in town for women?
There is not. I personally am trying to start one up here. I was born and raised in Duluth, live in Minneapolis, but come up here because I want to raise awareness in this region. I love Duluth. So there are patients up here that I come up to support and just talk to and say, I understand, I've been there. So Dr. Kristine Evans is doing a great job, and she is sharing with her patients Charlene's Light's information.
Talk about the events that are coming up next week, because you want to raise awareness and you want to raise money.
Yes, it's going to be a weekend of ovarian cancer awareness. It's the 3rd annual Light Duluth Teal. I started this because I was up here one day over 3 years ago visiting a patient. As I was driving out of Duluth, I was thinking, how can I raise awareness in this city? There are so many women up here that have been diagnosed with a gynecologic cancer. How can I help them? How can I educate the community? And as I was driving out, I glanced in my rearview mirror and the bridge was sparkling. I stopped my car, turned around, came back, went to the mayor's office.
This was your dream right there.
Yes, and I said, I have an idea.
And we have about 30 seconds left, so quickly run through the other events that people can get to.
September 17th through the 20th. The first 2 nights, Thursday and Friday night, Applebee's and Buffalo Wild Wings on Friday night, they're donating a percentage of their sales to Charlene's Light. And then Friday night, we're having our bridge lighting ceremony at the bridge, and there'll be a special memorial tribute. Saturday night is our big ovarian cancer, our gala, dinner gala at the deck, and Sunday is the Elizabeth Bushy Memorial Golf Tournament.
All right,
wonderful.
And it's charleneslight.org?
charleneslight.org.
All right, thank you so much, Kristine.
Thank you.
And appreciate the information.
Thank you.
Now for the business news from Business North, Fraser Shipyards in Superior is celebrating its 125th anniversary this year. The company has been building, lengthening, converting, and repairing large commercial cargo vessels since 1890. During the shipping season, the company provides service at any hour of any day when a ship experiences mechanical or structural damage. Every winter, Fraser provides ship upgrades for vessel owners and maintenance that is required by the United States Coast Guard.
As Polymet approaches its final regulatory reviews, the company announced it has spent $94.8 million on environmental and permitting costs. In its second quarter report, the prospective miner of copper, nickel, and precious metals said its environmental impact statement has now been reviewed by state and federal agencies. A final document will be published in the Federal Register this fall. That report will include a project update along with definitive cost estimates and a construction finance plan. Once those elements are in place, Polymet will seek permits from a variety of agencies.
Unlike many institutions of higher education, the College of St. Scholastica began its fall term with a 2.4% enrollment increase. The private Duluth-based college has 4,340 students, its largest ever enrollment. Now, about 70% of those students study healthcare. St. Scholastica's first classes were held in 1912 for a student body of just 6 women. This school year, the traditional undergraduate student body will be about 1,800, with graduate, extended, and online students numbering about 2,500. For more on these and other stories, visit businessnorth.com.
If you have a comment this week, call now, dial 218-788-2849 to leave a message, or send an email to almanacnorth@wdse.org. And you can always get the latest program information at the WDSE website, where you'll also find upcoming station events and much more. And Denny, don't miss Saturday night's broadcast of the Duluth Superior Symphony Orchestra.
Well, if you can't, if you can't get there in person, it is absolutely beautiful to watch and listen to on television.
It is.
It's a front row seat.
It is, and it's the first show of DSSO's new season. The season is Gods and Mists, and it promises to be a good one.
There you go.
All right, for Denny and the crew here at Almanac North, I'm Julie Zenner. We'll see you next week.